Good morning, everyone. We continue our conversation on Chapter 12 on processing and specimen handling. This topic is covered quite extensively on your national certification exam, so you should have very good knowledge about the content on this chapter, on the latter section of this chapter. Yesterday, we discussed the first section, which is mainly composed of computers and other topics that are covered as it relates to your knowledge in computer usage in the laboratory. But this second section is much more important because it contains a lot of information that you should know because it pertains specifically to your job, what you should be doing when you're handling specimens, when you're collecting specimens, and so on. So let's continue on page 383 on specimen handling. We know there's a lot of things, a lot that can go wrong during the collection and specimen handling. That's why it's very important that the analytical of or pre-analytical phase, which is what you're doing, right from the moment you receive your requisition all the way to the time when you turn in your specimen, has so many different things that can go wrong. Sometimes inadvertently, we can cause complications or unwanted results. So for this reason, you have to have vast knowledge because it's 50 to 70% of the errors that occur for specimens are caused during this phase, which is when the phlebotomist is dealing with the specimen directly. So let's talk a little bit about specimen handling. You know that patient identification is the most important step in the collection process. So therefore, you must ensure that you always use at least two identifiers, including stated name and date of birth, along with comparison of their ID band or any, depending on the setting that you're located at. So it's important that you collect those. Uh, some laboratories take it a step further and require that you also re-verify the information on the label as you show the tube to the patient. So that's what we call the three-way identification, right? So not only did you identify the patient directly, but you're also verifying that you're putting on the labels on the correct specimen, as this has been also a cause for errors, and that is why this has been implemented. So again, if it's something that has been requested for you to perform, it's probably because there's been errors that have happened in the past, and we're trying to minimize or eliminate the possibility of errors as it can cause serious injury or death. All right, so remember that the most important part of collecting the specimen is patient identification. Now, once you identify the patient, you're going to collect your specimen. After you collect your specimen in the right order of draw, you have to invert the tubes. That is something that we need to remember to do. We want to make sure that the additive makes good contact, mixes well with the additive, and therefore the blood specimen will be collected or handled correctly, right? What happens if you don't invert the tubes correctly? Well, again, the blood will have probably hemolyze, all right? It won't coagulate, or perhaps it will coagulate and cause microclots, and you don't want that. So it's very important that you invert tubes. Now, how many times? Most of the tubes require 5 to 10 inversions. Most of the tubes, except sodium citrate, which is your light blue. So it's very, very important that you ensure that you invert all the tubes 5 to 10. So if in the examination, on the national exam, if you see a question that will ask you how many inversions does the lavender require, 5 to 10, right? Is it, if one of the choices is 8, obviously it's between 5 and 10. So that would be your best choice. So again, in as a general rule, all the tubes require 5 to 10 except for sodium citrate. Sodium citrate requires only 3 to 4 inversions. Okay, now we're talking about gentle inversions, right? You can do the infinity sign, you can do any motion as long as you feel that you're mixing the specimen well, the blood is making good contact with the additive. Gentle inversion helps distribute the additive evenly for proper function. Vigorous mixing can cause hemolysis. Remember, hemolysis is the breakdown of red blood cells, and that is something you do not want because your specimen will be rejected by the lab and therefore have to be recollect and so on. Okay, so routine handling, mixing the tubes, very, very important. There are some tubes or some labs that are very severely affected by vigorous handling. Okay, and I know you probably won't be the one to invert the tubes too roughly or handle them roughly, but if you drop the tube, if for some reason the tube is uh, is not handled correctly, you're going to affect potassium levels, plasma, and there's just a whole array of different tubes that can be affected by vigorously handling the tubes. So please make sure that that you handle them correctly. So I'm discussing routine handling mixing the tubes on page 383. Okay. All right. So again, on page 33 under routine handling, I'm using the textbook so that you can highlight or make some notes because, as I mentioned a little while ago, there's a lot of very good information that is probably going to be covered in the national exam. So follow along and make some notes or highlight the book if you like to. Okay. So once you collect your specimen, you will mix the well specimen, make sure that all the additives make contact with the blood. You have to label the specimen. Now, specimens must be labeled immediately after collection at the bedside, right next to the patient. And we know that we perform three-way identification by showing, re-verifying the labeled specimen with the patient. Okay, that's just common practice nowadays. It's actually required, it's not optional. So once you collect your specimens, you have to transport them back to the lab. And transporting is obviously, again, very important. All the tubes that you collect have to be transported vertically. Okay. When you put a tube in a little rack and it stays vertical, what you're doing is you're allowing the blood to slide down onto the additive and therefore continuing the mixing of the specimen. So it's important that you remember that.
Mr. Reyes, no se escucha nada. Nada, todavía no se escucha nada.
Can you hear me now?
Yes, ahora sí.
Okay, awesome. I was trying to record, but I hope I hope the sound recorded. I don't know if it did. So once you collect your specimens, obviously you have to take them back to the laboratory. And the CLSI recommendations are that every specimen has to be returned within 2 hours. If you don't return within 2 hours, you're going to have problems like hemolysis. You're going to have some of the clots developing or micro clots in the tubes. So it's important that you bring them in within the 2 hours. When these tubes are brought into the lab, or let's say you work in a laboratory that is not close to your main lab, let's say you're a mobile lab and you're in Bronzeville and you collect your first samples at 6 in the morning, and you have other tubes to collect. By the time you're done, it's going to be 9 or 10 in the morning. What happens to those first tubes? They're going to start to hemolyze or clot. So what do you do? Well, the recommended thing to do is that you have a substation somewhere. Maybe you carry a centrifuge in your vehicle, or you have a facility that allows you to separate the tubes within that 2 hour frame. So that way you can bring them back. Once you separate them, then you can carry them, all day long and bring them back to the lab. So keep that in mind. So you hold these tubes in an upright position. Again, remember that. Um, this allows the tube or the blood to go back. So when you bring them back into the laboratory, the technologist will remove the stopper, the little cap in it, and it minimizes the amount of aerosols that are going to spray. But that's what they do once you bring them in. Non-anticoagulant tubes, gel tubes, should be placed in an upright position as soon as they are mixed. General transportation guidelines. How do you transport these tubes? In the hospital, right, where you have the lab, probably in another floor, uh, you're going to be carrying them in biohazard bags. I think we talked about this before. What is a biohazard bag? It's not just a Ziploc, right? It has to have the logo, right? That orange symbol. It has to have a seal, right? A liquid tight closure, like the Ziploc. And then it also has to have another pocket on the side where you're going to put paperwork. So those are the three components of a biohazard bag. Now, the automated transportation systems, like the pneumatic tube system, that tube system, again, we discussed that there's got to be different measures to prevent, any possible breakage or leakage into the tubes. So it's important that these tubes, the tubes themselves, have a liner inside them. Okay, I don't know if you can tell from the picture on 385, but the container itself is round, it's big. Okay, and then you have this other container that looks a little bit more cone shape. Okay, so that container has a liner, and then you put your specimens inside the Ziploc. So there's like three levels of protection in case the the specimen should break, right? It's not going to make a big old mess. Plus, the tubes should be plastic, right? The container also has to have some kind of cushion, right, to minimize vibration. Because remember, if there's a lot of vibration of movement in the tube, then what happens to the blood? It's kind of like you're shaking the tube, right? So it's going to start to hemolyze, or it's going to get rejected, because all these little vibrations can cause the blood to hemolyze. All right, so specimens should be packaged correctly in leak-resistant containers, sealed in a zipper-type plastic bag to contain spills, and the carrier should be fitted with disposable clear plastic liners in case of leakage. Carriers must also contain foam pads and special pad liners to provide containment and cushioning during transport. And then there's a bunch of labs that can be negatively affected by the vibrations and not following these guidelines, as far as automated transportation systems, like the pneumatic systems. So let's say you work in a mobile lab. How do they carry their specimens? There's some rules that they have to follow as far as carrying the specimens. So you have all your specimens, bringing them back, from wherever you were at, bringing them back to your lab. Now you have to put them in a container. Okay, there's certain measures that you have to follow. The transport box, right? You say you're going to put them in the transport box. This must be closed to avoid any spills, obviously. Okay, and your specimens are going to be, again, in a sealed Ziploc biohazard bag. That bag has to be in another container, and that container has to be in the plastic box, right? Well, it could be metal, it could be wood, it could be plastic. It doesn't matter. That transport box has to be located behind the driver seat on the bottom. Okay, why does it have to be there? Well, it kind of minimizes the movement. It's not going to be sliding back and forth like if you were to put it in the trunk or on the seat. It won't be moving around and shaking, possibly causing causing the specimens to get hemolyzed. Also, you want to protect that box from too much heat or too much cold, and of course from sunlight. Some specimens require that they're protected from sunlight. So by putting it behind the driver's seat is the best possible location. Or also, if you have a special box, some of them you can tie them down to the seat belt. Okay, now these are probably special boxes that have that ability, so that again the boxes are not going to be sliding back and forth, and shaking the specimens and causing hemolysis to the specimens. So imagine, after you collected 20 or 30 specimens and you bring them back and they're all hemolyzed. That's not a good thing, right? So that's why you have to take special precautions. All right. On 386, the Department of Transportation also has guidelines for those laboratories that carry more biohazardous specimens, okay? But we're not so concerned about those. We're more concerned, you have to know more about the what they call the uh, category B specimens, right? Your normal, typical laboratory specimens, right? Uh, how do you carry them? How do you store them, and so on? All the guidelines are there on page 386, and they're pretty much what I just went over. Okay, so go ahead and read those on your own, but it's pretty much the general guidelines that I just discussed for local carrier transport. You know, you're locally, you're from Brownsville to McAllen in this region. It's not like they're going to San Antonio, which would be totally different. Now, time limits. How much time do you have to separate the blood or the cells from the plasma? I said you have, as a general rule, 2 hours. So from the time you collect your specimens, okay, you have to bring them in within the 2 hours. All right. What happens if you don't bring them within the 2 hours? What could possibly happen? Well, as you know,
The breakdown of the red cells?
that, or the red blood cells, when the blood is still whole, okay, it's still there. All the cells are still working. The cells are still alive, and they're eating everything that is in the blood, your sugar, your electrolytes, and all that kind of stuff. And there's a lot of other chemicals that can grow if they're left on there sitting too long. So again, that is why it's very important that the specimens are separated, right? The cells are separated from the plasma or the serum right away. Okay. So keep that in mind. 2 hours is the general rule. Glycolysis is what? The breakdown of sugar, right? The breakdown of sugar. So if again you don't separate the cells, a lot of the sugar that is in the cell in the specimen will be broken down by the cells. And again, if you're looking for a sugar level, glucose level, then it's not going to be accurate. So there's a lot of things that will break down or keep metabolizing. The cells are still alive. So those are some of the time limits, okay, as a general rule. What is the time limit to separate the cells?
Is
Anybody
it 2
remember?
hours?
2 hours is correct. Very good. Now there's a few exceptions. Okay, you don't have to wait 2 hours all the time, right? If you can bring them in 30 minutes, an hour, it's fine, as long as you bring them in within the 2 hours to the lab. Or if you're far away and you can't bring them within 2 hours, you know you're gonna have to separate them wherever you're at and then bring them into the main lab. So stat or medical emergency specimens take priority all the time, right, over any other specimens, and should be transported immediately. So if you go to the emergency room to collect a stat, obviously you're not going to go around and continue your work, and then when you can bring them back. No, you have to bring that specimen to the lab right away so it can be processed. All right, another exception, ammonia. Ammonia specimens. What is ammonia? Ammonia is a waste from the body. Okay, ammonia is a waste from the body and is eliminated through the urine. So blood ammonia levels increase rapidly at room temperature. So if I ask you, go collect an ammonia level, and you collect it and you have it, vertical on your rack and all that, right? You're transporting the specimen fine, and then I see that that specimen, and I'm like, that's not going to work. Why? Because ammonia levels will continue to increase at room temperature. So what do you do to prevent it from increasing? You have to put it in ice slurry. Okay, so you have to know this. This is probably going to be on the national exam about ammonia. All right, because it's a very common test that is done. It's done a lot when patients have a liver failure, when their kidneys are not working very well anymore, or if they have a sudden confusion. They may have too much ammonia in the bloodstream. Ammonia travels to the blood and into your brain, and it makes you very confused. So this test is a very common one. That's why it's probably you're gonna see it in the national exam. So be aware of that. Okay, ammonia goes in what?
In ice.
In ice slurry. Remember, it's not the same thing. You put it in cubes of ice or ice water, it's crushed ice. Okay, ice slurry or a cooling tray. It has to be separated from the cells within 15 minutes of collection. So it's almost like a stat, right? Ammonia has to be separated right away within 15 minutes. Other specimens like coagulation specimens, how many inversions does the light blue require? We said
Only 4.
3 to 4 is correct, right? All other specimens require
Up to 10.
5 to 10. Remember that, 5 to 10 inversions, all on most specimens except for sodium citrate, okay, which is 3 to 4. All right, so coagulation studies, right, which is your light blue, sodium citrate. Ideally, these tests need to be done, like the separation or the test, the whole test has to be done within 3 to 4 hours, okay, to be able to get a good result. PT specimens can be held at room temperature or centrifuged with a plasma up to 24 hours. So the light blues can actually stay in place, right? Separated for up to 24 hours. Okay, but you have to separate them after before the 2 hours. PTT specimens for monitoring unfractionated heparin level must be centrifuged within 1 hour. Those are more specific labs that you probably won't be asked about in the national exam. The common ones that you do have to know are PT and PTT, right, which is your light blue. Glucose specimens drawn in sodium fluoride tubes are stable for 24 hours at room temperature and up to 48 hours. What is sodium fluoride? What is sodium fluoride? What is a word to describe what does sodium fluoride do? It's an anti what?
Anticoagulant.
No, anti-glycolytic. Remember, it's your gray tube. You can have EDTA, right, or sodium heparin or lithium heparin. It's used for glucose levels, right, and it has sodium fluoride, which is an anti-glycolytic. Anti-glycolytic means that the sugar will not be broken down. Okay, it'll stay in the specimen, so it doesn't let the cells eat it up.
Sir, aquí dice que tiene que estar stable, like, ¿cómo? Que no lo podemos estar meneando de un lado para otro.
No, it means that you can have it in the tube up to 24 hours. Like because the sodium fluoride keeps the cells from eating the sugar, it'll be fine. Nothing's going to happen to the specimen, right? But if you collect a glucose level on any other tube that's not the gray, it doesn't have sodium fluoride. So what's going to happen to the sugar? The cells are going to eat up the sugar. So you're going to have inaccurate results. So it means stable. It means that all the analytes, the sugar, and everything else, it stays pretty much the same. All right. Pediatric glucose specimens. Glucose specimens for newborns and pediatric patients should be tested as soon as possible. Hematology specimens. You have to know about hematology, right? Where do you collect, what color tube do you collect hematology specimens?
Lavender.
Lavender is correct. All hematology specimens, studies of the blood, right? Like your complete blood count. In the CBC, you have your white blood cells, you have your red blood cells, you have your platelets, okay, and you have your different kinds of white blood cells. So those are collected in lavender, and they go to hematology. And this is a tube that you can get a blood smear from. Okay, remember we try to practice the blood smears here, which are very difficult. You get a sample from there and you put it in the slide and all that. So blood smears made from EDTA specimens must be prepared within 1 hour. Remember that. You're going to see that in the national exam. EDTA specimens for CBC should be analyzed within 6 hours, but they're stable for 24 hours at room temperature.
Mr. Reyes, otra vez no se escucha nada.
Okay, there. Can you hear me there? Yes.
Yes.
Oh, okay. I was messing with the microphone. So, yeah. So the ESR is done commonly for older adults that have arthritis. Okay, it measures their rheumatoid arthritis or inflammation in their body, and that's when the doctors will try to increase their medications for pain or inflammation and so on. So this is again a very common test. Remember, it's ESR, so you have to know what ESR is. uh, EDTA specimens for reticulocyte counts are stable up to 6 hours. This one is not a common test, so you don't have to worry about that. All right, so we're talking about handling the specimens, right? How soon should they be separated? How soon should you bring them to the lab? And we talked about a few of them that are very common, okay? And there's more, of course. Microbiology specimens, such as their cultures, like it would be a blood culture, urine culture, sputum culture, whatever specimens. After you bring them in, the specimens are transferred to culture media, where like those little dishes where they put the sample in, and then they put them into the incubator, okay, the warmer, where they're going to start growing for 3 days. Urine specimens are not tested promptly. Urine components can change. If you're going to collect a urine sample for urinalysis, okay, you cannot have it laying around the desk for too long. How long can a urine specimen be at room temperature?
Up to 48? No, up to 24 hours. No, 2
You would,
hours.
2 hours. There you go.
Pero
So
en el refrigerador dice que 48 hours.
yeah. So, like I said, the lab doesn't come in to pick up specimens, every hour, or they come once a day, once a day. So if you collect a specimen early in the morning and they don't come until the next day, obviously it's going to have to go in the fridge. And I did mention this yet the other day, right, when we came here in class. So specimens cannot be, if they cannot be transported or analyzed promptly, they can be held at room temperature and protected from bright light up to 2 hours. So you can store it anywhere there. You know, underneath the desk, not the desk, but somewhere protected from light. But after that, they have to go in the fridge. So that you have to know, okay? For sure, you're gonna see it on the national exam because it's a very common test that is done very, very commonly, okay? All right, a special handling. Now, there are some specimens you're gonna be collecting that require special handling. So in addition to collecting it, right, handling the specimen correctly and all that, you have to make sure that you follow the guidelines. So there's different temperatures. There's body temperature, room temperature, refrigerated, and frozen. The ones we're more concerned about are the body temperature, uh, room, and refrigerated. And now it gives us in Celsius. I don't like it, but it's in Celsius. Okay, so the specimens need to be transported at or near normal body temperature of 37 degrees or 98.6 for us. Okay, if you need to carry a specimen like this, you have to have the heat blocks, right? Heat blocks are manufactured, okay, items that go at 98.6 or 37 degrees Celsius, and they hold the temperature only for 15 minutes. Okay, some facilities have packages, okay, that do that same thing. It's not a block, but it's more like a bag that you break it, and it makes it keeps the specimens at 98.6 or 37 degrees Celsius.
Es como el que está aquí en la picture.
Yes, on page 389 you see well, that's the blue one.
Yes, el que está arriba.
Yeah, or you see the little bag has a warmer.
Yes. Mhm.
Okay, so that's kind of like the heel warmer that you will use for capillary sticks, but instead you will use it for the tube to keep the specimen at 37 degrees Celsius. So there's some that need to be kept at that temperature. Those are, if you look on 389 on the table 12.2, on the very top row, you see the keep at 37 degrees Celsius. You see that? Keep at 37 degrees Celsius. Those are your cold agglutinants. Cold agglutinants. Those have to be kept at 37 degrees. Cryofibrinogen, cryoglobulins. If you look at the words, guys, cryo means cold. Okay, so it's kind of the opposite. The cold specimens have to go on warm blocks or warm temperature. So please, the one that you're probably going to see is cold agglutinins. It's a more common test that is done. So please remember that. Room temperature, cold agglutinins. It's probably going to be on your national exam. Now, if you go to the next column, chill in ice slurry or cooling rack. Okay, if you don't have a little cooling block like the one on figure 12.6, okay, it's a nice chameleon cooler, right? It's an ice block with little holes in it. Ammonia, we just talked about it, right? Ammonia is a waste from the body. It has to be kept at or chilled in ice, okay? Lactic acid, I think we touched on it, was it yesterday? Lactic acid also has to be in ice slurry. pH or blood gases, like arterial blood gases or capillary blood gases, have to be put in ice slurry. Those three are the most common ones, and probably you're going to see them on national exam. Very, very important. The next one, protect from light. The most common one of all is bilirubin. Remember, bilirubin is a product of red blood cell destruction. When
Ese
the red
también
blood
tenemos
cell...
que ponerlo en ice, ¿verdad?
Okay,
El bilirubin.
no. Look at the very top, whatchamacallit? The like I said, protect from light. You see that? Protect from light.
Yes, I see it.
Okay. The ones below that are the ones that have to be protected from light, like bilirubin. And if you notice, the other ones are vitamins. Vitamins A, B, C, all those have to be protected from light as well. So this little table, you have to make sure that you're familiar with it, okay? Again, room temperature, cold agglutinins. Cryo means what? Cryo means, what does cryo mean?
Like priority, like first, I don't know.
Cryo means cold. Cold. So if we tell you that the specimen has to be in ice, what does it mean? It means that it requires chilling and should be transported in ice slurry. Ice slurry is crushed ice, all right? So again, there's a reason why. Why do you have to put specimens in ice or ice slurry? So that you slow down metabolism, okay, of the cells. So the cells will kind of like slow down. They're not working so much, and they're not using up all the analytes. Everything is in there. The glucose. They're not going to use it because they're cold, so they won't work as hard. That's the whole point of putting things on ice, like ammonia, lactic acid, ABGs. Now, there's specimens that cannot be chilled. Must not chill these specimens, and these are coagulation studies. Your light blue tube cannot be in ice. If you do, you're going to accelerate clotting, and that's exactly what you don't want. Right now, I mentioned a couple of specimens that need to be protected from light. So how do you protect these from light? Well, the most common example is bilirubin. Okay, bilirubin, we said what? It's a breakdown of what? Red blood cells. So bilirubin, when exposed to light, breaks down faster. So if you don't protect it from the light, you're going to have false high results. Okay. So as soon as you collect that specimen for bilirubin, especially for kids, you have to either collect it in an amber tube like the one you see on page 390, or you wrap it with foil, which is more commonly. A lot of labs do not have the amber tubes, but that shouldn't stop you from wrapping it from foil, but a lot easier. Okay. Any questions on the handling of the specimens? This is a lot of the work that a phlebotomist does. So obviously you have to have knowledge about it. You have to know how to handle the specimens when you after you collect them, right? Because if you don't handle it correctly, well then what's the point of collecting it? It's going to be rejected. So the next section is specimen processing. When you bring the specimens into the lab, they're going to be processed. Most of the large labs have the processing center. A lot of doctors' offices, they don't process the specimens. They just collect them for the labs, and then they send them to a lab, and then the lab sends them results and so on. Um, I happen to live behind a doctor's office, and I see the laboratory people come in to the back door. They have a box where all the specimens are in, and they just pick them up and they take them. Um, there's several laboratories here in the area that do that. They're mobile labs. All right, so if you're going to be processing specimens in the lab, okay, you have to wear obviously PPE, your gloves. You have to wear probably a complete gown, probably a shield as well, disposable aprons and all that, because you're going to be exposed to body fluids, in this case, blood, or other body fluids as well. Goggles or a face mask. Specimen suitability. The most frequently cited reason for rejection of specimens, chemistry specimens, is hemolysis. What is hemolysis? What is hemolysis? The breakdown of what? Red blood cells. The second most common reason is quantity not sufficient. What does that mean? Quantity not sufficient.
Que no hicimos collect enough.
Exactly, right? Underfilled tubes, right? Maybe you lost the blood flow, you couldn't get it back, and you thought, well, maybe I think I have enough. Maybe you don't. So you should always collect the specimens until the vacuum is exhausted, okay? That is the two most common reasons why specimens are rejected. The most common reason for hematology specimens, or in other words, your lavenders, is clotting. Clotting is also unacceptable for coagulation specimens. So hematology and coagulation, they clot. Why do they clot? Why do the specimens clot? It could be a lot of reasons, including rough handling or not bringing them in a timely manner, not separating the blood from the plasma or serum in a timely manner, right? Incorrect, using the incorrect needles. Uh, the needles are too small. When you collect your specimens, that's going to cause probably hemolysis or clotting. So it's very important that you follow the the guidelines when you bring in your specimen. Now, pre-centrifugation, the centrifuge is the machine that we have here, right? Remember the one we did the other day? We put the tubes in there and we spun them and we separated the the red blood cells from the plasma, or it was, yeah, the plasma. Anticoagulant tubes for plasma tests. Again, anticoagulant tubes for plasma tests, including those that are also contain gel, can move onto the centrifugation phase without delay. So as you saw, the sodium citrate is what kind of additive? It's an anticoagulant.
Yeah.
Anticoagulant, right? So that means that any anticoagulant, you can centrifuge it right away, just like we did the other day. Now, if we collected a tiger top or a red tube, when can we centrifuge it. When can we centrifuge clotting tubes or serum, we call it serum tubes, until they start to form clots? So when you look at the blood, right, you're going to see little blood clots in there. It usually takes about 45 minutes to an hour for a serum tube to start clotting. Okay, you got to let it clot by itself. You can't, shake it vigorously so it start clotting. So you can't centrifuge it until they're clotted. All right, so now once they're clotted, okay, you're gonna put them in the machine and the centrifuge. Make sure that they are clotted, obviously, that you see little blood clots in there. What is the rate, how fast, like how much time, and what is the speed they're gonna be centrifuging? Usually, you can set the machine to about, how many RPMs? About, where's the machine? Oh, I have it over here. It's going to be, where is it here? At least 1,000 RPMs for 10 minutes. So a minimum of 10 minutes. The gel tubes, the other tubes that have the gel have to have a little bit more RPMs. So you can go about 1,300 RPMs to be able to separate the gel, to get the gel from the bottom and separate it with the blood and all that. Remember the thixotropic gel? It's used to keep the red blood cells in the plasma or the serum separated to make that little barrier. So it requires a bit more, a faster speed so it can separate correctly. Specimens for plasma that are collected in tubes containing anticoagulants may be centrifuged without delay. We already know that. Stat chemistry tests are sometimes collected in green tops. So any chemistries can be done in the greens. They can be centrifuged right away. Your RST tube can be done right away. Serum specimens should not be centrifuged until it is determined that clotting is complete. Complete clotting normally takes 30 minutes to 60 minutes at room temperature. Now, patients that are taking medications like anticoagulants, it's going to take them longer to form a clot. So you just have to wait until the specimens are actually, you can see the little clots forming in the blood to be able to centrifuge it. You can tilt the tube and you're going to see little blood clots in there. That tells you that the clotting has already started and you can centrifuge the specimen. So just tilt the tube and you'll see the clots in there. Okay, one more thing before we take a little break. In centrifuge operation, the machine, you have to know a little bit about how to use it, okay? There's a couple of things that you have to know. The machine has to be balanced, it cannot be vibrating, because if it vibrates, it's going to cause hemolysis, okay? So make sure that the machine is balanced. You have to put equal size tubes. So the other day we put 3 tubes of the same size with almost the same amount of blood, right? One of them was a little bit less, but it was pretty even. So same size of tube, the same amount of blood, okay? And they have to be separated. If the machine has 6 slots, okay, and you have 3 tubes, then you put one and skip one and another one, skip one and another one, right? So they're kind of balanced out. Let's say you only had two tubes. How do you balance out the machine? Well, you can fill that tube, the extra tube, with water. You fill it with water and you fill out the empty space that you have. Remember, you got to have balance. If not, the machine will start vibrating. Okay, it spins really fast. So if it's not balanced, it'll start vibrating and you're going to cause hemolysis in the specimens. So what is your job as far as the machine, the centrifuge? You have to be able to perform maintenance on the machine. Okay, what is maintenance? Cleaning the interior of the machine with soap and water, obviously disconnected, right? With soap and water, with the gloves, obviously, followed by a bleach solution, maybe a 1 to 10 solution, or a disinfectant. So maintenance has to be performed on a regular basis. Like every day you're going to use it, just like the point of care devices. You have to perform maintenance checks on the machine, make sure that it's working properly, and you're going to document it. Not just say, I did it. You have to actually document it. All right. Post centrifugation, after you separated the cells from the serum or the plasma, they have to be well, they can stay in there. Usually the labs can keep them in the fridge for a very long time. You don't have to know that much detail about it, but once they're separated, then the specimen is processed if they're stat, or if not, they will be put in a refrigerator until they get to them. Okay, so we're gonna stop right here and take a little 10-minute break, and then we'll be right back so we can finish up the chapter, which is actually we're almost done. But we're gonna go ahead and review some of the questions in the back if you wanna take a look at them, if you're not too busy. So let's take a 10-minute break and we'll be right back, all right?
Okay.
All right, so we continue here in the last section of chapter 12. Uh, you need to be familiar with what an aliquot is. An aliquot, it's a strange word, even to pronounce it, but it's a sample from a specimen, from a blood specimen. So once you brought in the specimen to the lab, somebody in the lab is in charge of removing the stopper, that the cap of the tube. So you have to be very careful. That's why when these people remove the stopper, they have to be wearing a full face mask, okay, or face shield. Why? Because when you pop off that specimen, that means that there's going to be some aerosols or very fine mist that might spray. And if you're not wearing a shield, it can go into your eyes and you would be exposed to it. So it's really important that you wear a complete face shield. Some of the tubes, I think one of the brands, actually the cap is designed to be able to minimize the amount of aerosols, but nevertheless, you still have to wear your face shield. And of course, that's why it's not recommended that you remove any caps anywhere at any point unless you're going to be performing aliquoting, which is getting samples from the serum or the plasma. And that's really all it means. And this is, like I said, usually performed in the lab. Usually it's performed under a shield. They have like a special shield. You also have your own shields and all your equipment, your PPE, so that you don't have any exposure to aerosols. According to OSHA, all procedures involving blood or potentially infectious material shall be performed in such a manner as to minimize splashing, spraying, splattering, and generation of droplets of these substances. So a lot of these labs have they have like an exhaust system, like a vacuum, that if you were to open that container, if there is any sprays or droplets to sprayed up, the system will automatically suck them back up. Okay, including the shield and then your own PPE. So the risk is very minimal. Pouring the serum or plasma into aliquot tubes is not recommended. Usually the way they collect these aliquots is using little pipettes, the very small tubes, and they get a sample from there and then they put it into the analyzers for the machines. And that's how they collect the specimens and run them. So out of one 5 ml tube, you might have about 3 mLs of specimens. So from 3 mLs, you could probably run at least 3 or 4 different types of exams. Some machines require 1 ml, some require even less. So it's not a whole lot that you can do on one simple specimen. According to CLSI, serum or plasma aliquots can remain at room temperature for no longer than 8 hours. So after they've been collected, separated, and all that, they have to be put in a refrigerator at about 4 degrees Celsius for if they're going to be sitting around for more than 8 hours. Serum and plasma aliquots should not be frozen and then thawed out for more than once. So again, this is more in the lab itself when the specimens are being processed and put in the analyzer. So this is probably not so much in the phlebotomist role unless you are trained to do that. But as an entry-level phlebotomist, you're not going to be doing that immediately. And just for your knowledge, you're in the exam, you're not going to see too many questions about post-analysis as far as the specimens are concerned. So, all right. Reporting results. One the last part. Once the results are produced, the analyzers give you the results. These results have to be reported to the physicians, to the prescriber, whoever ordered the test, either by phone or fax machine. But you do have to report some labs. Some labs have very abnormal results, which include panic values. They call them panic or critical values. You need to know what this means. Panic or critical values are those that are above or below the reference range. We talked about reference ranges in the previous chapter. So let's say you collected a light blue for coagulation studies, and the results are above the reference range. Well, it's going to be somebody's job to make sure that the physician knows the results. Let's say you're the phlebotomist in charge of reporting results. So if you call the physician, you have to make sure that you get a name of the person you gave results to. If it's a doctor's office, it's usually going to be a medical assistant, or and the time, and also that you also read back the results. For example, if you're calling me to my office and I answer the phone, say, well, I'm calling to give results on patient John Doe. His PTINR is such and such numbers. Can I have your name? Well, I give you my name, and you're going to write down the name, the time, and then you're going to ask me, can you repeat the results? And I'm going to repeat the results back to you, and you're going to say, okay, I read back the results to you. That means that I understood and I read them back to you. Okay, so for that reason, it's very important that you make a note of that, because now that you've given the results to that person, they're in charge of giving it to the doctor. Because sometimes you may not always have ready access to the physician. So you do your job and report those results, especially if they are critical or panic values. Okay, I think it's one of the new safety national patient safety goals. Community is part of the communication. Many times there were results that were abnormal and they were never reported to anybody. So what happened? Well, the patient went on without the correct treatment and probably had, a complication or even death. That's why it's a national patient safety goal that we improve communication. And if you do your job, then everything will be fine. But if not, then you're going to have complications. Okay, so remember that. Know what panic or critical values are. Okay, these are results that are above or below. You could just say they're out of the reference range. All right. Okay, so let's go over some study and review questions on page 397. You there, Miss Erica?
Yes, I'm here.
Okay. All right, so computer networking, we're going to skip the computer questions because really, you're not going to see questions on it on the exam. So we're going to the other ones. After arriving in the laboratory, all specimens are immediately what? What's your best guess?
¿Dónde están esas questions? Because I don't see them.
I'm on page 397. Study and review questions.
Okay, on the first one.
Number 3.
Would it be B?
B is correct. After you bring in the specimen, it has to be logged in or accessioned. Remember, it has to have a number for the specimen. Number 4, which of the following would be omitted from a lab-generated computer label? When we discussed about labels, you have to have certain information in it. Which of these does not belong in the label?
The patient's diagnostics, which is B.
That's correct. The diagnosis does not have to be part of the label. Number 5, barcoding in this area of healthcare is unlikely at the present time. Barcoding.
Would
And
it be
this
the
one you
first
could
one,
say
the
yes.
CLIA documentation?
Yes, CLIA documentation. CLIA refers to the law that was passed to standardize all the labs, right? So that everybody would be doing the same. Law was passed back in 1988. Okay, so whenever you see the word CLIA, that's what it is. It refers to the law. All right, next one, C, number 6. Which of the following specimens should be protected from light?
You just said the answer, sir. It's bilirubin.
I just said it like right now, right now.
Yes, you said it before asking the question. You said letter C.
Oh, that was accidental. I didn't mean to say the answer. It was just by coincidence. But you're right. All right. Which of the following is a type of machine used to separate the serum or plasma from blood cells?
Would it be the stack spin?
That's correct. The letter D. You saw the picture of it, right? How did you know the answer?
Sir, ahí está en la picture.
Okay. Number 8. After obtaining a specimen for a cold agglutinin test, the blood must be transported.
Would it be a cooling rack?
Cold agglutinin is the opposite.
So it'd be at body temperature, B?
Yes, body temperature. Yes, that's correct. Body temperature is 37 degrees Celsius. So anything that's cold or cryo has to be kept warm. Required PPE when processing specimens will exclude
The shoe covers.
the shoe covers. Shoe covers, correct. Number 10, which of the following blood specimens should be transported in ice slurry?
Did we cover that one, sir?
Yes. Well, we talked about ice slurry. In ice, it's on the little table on page
It's
389.
that's 389.
I didn't mention it because it's not a common test, but it is. It's homocysteine. Homocysteine.
La D, ¿verdad?
Correct. Yep. 11. A serum aliquot has a fibrin clot in it. The most likely cause is the specimen was.
Would it be C?
A fibrin clot. You said C?
Yes, from improper transportation.
That's correct. That'd be correct, yes. So remember, you don't want to vigorously shake. You got to make sure they're very stable. 12, which of the following specimens would be acceptable for testing?
La A, sir.
Yes, that's the only good choice, right? 13, as a
Yes.
general rule, serum or plasma should be removed from the cells within.
I don't think we covered that one.
Yes. It's 2 hours, right? It's 2 hours, so it's going to be letter D, 120 minutes.
That's 2 hours.
Mm-hmm.
Okay.
Okay. Number 14. Which of the following specimens can be centrifuged immediately? We said some specimens can be centrifuged right away as long as they are in an anticoagulant tube, right?
Would it be the electrolytes collected on a PST?
Yes, that's correct. Wow, you're good, Erica. 15. The difference between barcodes and radio frequency identification is? That was way in the back of the beginning of the chapter. Let's skip that one. Number 16, most POC analyzers are interface capable, but the decision to do so is based on the
impact the test result has to the patient.
correct. 17, all blood specimens transported by a courier, that means like a person that carries the specimen. All blood specimens transported by courier must be
Sir, would it be C? Because it's the only one that makes sense.
That's correct. Very good. Yes, you have to protect it from direct sun exposure. The other ones are not correct. 18, which federal agencies regulate the transporting of biological specimens off-site? Which federal agency?
Dot. I remember.
That's right, the DOT, the Department of Transportation. 19, which of the following test specimens can be analyzed without being centrifuged?
Would it be the hemoglobin?
Hemoglobin? You can actually do bilirubin. Bilirubin. 20, a panic value is a?
Would it be abnormal test result?
Significantly abnormal test result is correct. You did pretty good. You did pretty good, Miss Erica. You are paying attention. Okay. Let's do one case study and then we'll stop. Okay. The case, no, let's do the second one. 12.2, a cooled specimen gets a chilly reception. So a new phlebotomist was working the early shift at a medical center and had already completed most of his assigned draws. He was then given a stat order for ammonia, electrolytes, and CBC on a patient in ICU. So ammonia, electrolytes, and CBC. Only one arm was available for the draw. The patient had lots of bruising and non-palpable veins in the AC area, so he decided to draw a hand vein. He couldn't remember if the ammonia required a green top or a purple top. So he grabbed a green top lithium heparin tube and two purple tops for his phlebotomy tray. The draw was successful, and although the blood flowed into the tube slowly, he was able to fill all three tubes. He also remembered that the ammonia needed to be transported on ice, so he went to the nurse station and got a plastic bag of crushed ice and water. Since he wasn't sure which tube was needed for the ammonia, he put the green top and one of the purple tops in the ice slurry, just to be safe. He had only one more draw to do, and the patient was on that same floor. So he quickly drew her, returned to the lab, and delivered the specimen to central processing. A short time later, the central processing technician told him he needed to immediately redraw the stat electrolytes. So the electrolytes had to be redrawn. Were correct tubes drawn for the order tests?
Well, the ammonia specimen has to be collected in the EDTA
Okay.
tubes, right?
So he got the lavender right.
Yes.
And then what about the electrolytes?
Well, was the only one that he did, or she didn't do it right.
What happened?
Or
What did she
she,
not do right?
well, she has to redraw.
Why? The green top. You put the green top, the electrolytes go on the green top, and you put it in ice.
What was that color? Because she wasn't sure what color she has to collect
Right?
it, right?
Right. So just to be safe, right? He put the green and one of the purples in the ice, which the purple one was fine because that was for the ammonia, but the green should not have been in ice. Okay. So what happens to specimens when that shouldn't be chilled? You put them in ice. It accelerates the clotting. It accelerates clotting.
Oh, yeah, if
Yeah,
you
and you're
put it
gonna
on
have
ice.
microclots in them. Microclots. So clots affect electrolytes. How could this problem have been prevented?
Well, first of all, she would have confirmed that color tube, and she should have known that the ammonia one should not be in ice.
So all you had to do was ask, all right? All she had to do was ask someone, especially if you're a new phlebotomist, you need to ask questions. You can't go by like, oh, you can't be unsure because remember, we're dealing with patients' safety and health, and we can't be working unsafely. You know, she didn't do the right thing by not asking. So the what you call it, the exam for the national exam, I'm thinking we can do it on Friday the 13th, which is not this Friday but the next Friday. So I sent an email. I don't know if you received it already.
Yes,